Problem physicians coming to Texas to escape their pasts. Last night we revealed some doctors who've lost their licenses in other states practicing in Texas with clean records, and patients have no clue.
Tonight, KXAN investigator Matt Grant reports on renewed calls for transparency when it comes to your health care.
National Practitioner Data Bank.
Yeah, that thing established by Congress.
I know.
To warn the public and other hospitals about bad doctors.
I know.
5 years after Dr. Christopher Dunch was sentenced to life in prison, some involved in the infamous Texas case say patients are too often kept in the dark. From the real-life Dr. Robert Henderson,
right now the public isn't getting the information that they need,
to Dallas attorney Kay Van Way.
There's no transparency in healthcare.
Who represented more than a dozen victims in court of the man dubbed Dr. Death.
I remember how diligent those patients were in trying to research their doctor and were absolutely lambs led to the slaughter because there was no public information available about Dr. Dunch.
But the information does exist, just not to patients. In 1986, President Ronald Reagan signed the Healthcare Quality Improvement Act. That paved the way for the National Practitioner Data Bank, a confidential clearinghouse containing things like if a surgeon is banned from operating at a hospital, medical malpractice, and disciplinary records, all required to be reported by state medical boards. It's designed to protect the public from doctors like Dunch. The problem? Only medical boards and hospitals can access it at a cost of $2.50 for every search. Van Way wants it opened up to everyone.
Even in the instance, if a patient was harmed and they hired a medical malpractice lawyer and a lawsuit was filed and we tried to subpoena that information, by law, that is secret. And that has got to be changed.
Van Way says unsealing the data bank would help patients make more informed decisions when it comes to choosing a doctor or surgeon, especially when a KXAN investigation found out-of-state disciplinary actions kept secret on the Texas Medical Board's website.
Lack of transparency in healthcare is killing patients. It's not if another Dr. Dunch is going to come along and hurt people, it's when.
Some physician groups, like the American Medical Association, oppose opening the data bank, arguing the information could be wrong, misleading, or misinterpreted by the public, needlessly damaging a doctor's reputation and violating their privacy.
There needs to be a much better system to get the information out to the public.
Dr. Robert Oshel is a former official with the data bank, retiring after 15 years. He's seen the information it contains and says the public should too.
If you can't get full information about their record, you can't really protect yourself against the very few that are like Dr. Death.
A KXAN investigation found nearly 50 doctors who've been disciplined or had their medical license suspended or revoked in other states, able to or still practicing in Texas with clean records. More than a dozen of them were issued Texas medical licenses after facing disciplinary actions in other states. The TMB says it checks the data bank for new medical license applicants in Texas and when it's investigating a doctor, suggesting the board was likely aware of these potential red flags when the licenses were issued.
As far as does the medical board go and review all 154,000 of our licensees to make sure that they've disclosed everything that's come in, that's something that's a little more time intensive that the medical board has not in the past done.
So where does the buck stop when it comes to protecting patients and notifying them about these potential problems and catching these cases?
Well, I mean, that's what we're charged to do here at the medical board, is to help protect the public and get that information out there.
But Oshel says that information is not getting out to the public, and patients are the ones suffering.
There's a lot of improvement that could be made, and it's not just Texas, it's pretty much everywhere.
Opening up the data bank would require an act of Congress, something experts say is unlikely to happen. Coming up tomorrow night after the Olympics, our investigation continues as the Texas Medical Board says it's now making out-of-state disciplinary actions public. But we found that fix hasn't fixed much so far. In Austin, Matt Grant, KXAN investigates.
Matt, thank you. The Federation of State Medical Boards is another resource that states like Texas rely on to catch these bad doctors.
The nonprofit provides physician discipline reports to all states where they have ever held a license. We have more details on that group in this story in the investigative section of KXAN.com.